Starting your very first therapy session as a clinician can feel overwhelming. It's totally normal to feel a bit nervous. Before your client arrives, take a deep breath. Maybe arrange the chairs, check your notes, or pour a glass of water. When you greet your client, try something simple like, "Hi, I'm glad you're here today." Offer a warm smile and gentle eye contact. Little gestures, like offering water or asking, "Would you like to sit here?" help set a welcoming tone. These small actions make a big difference. First things first. Let's talk about creating a container. This means setting up a space where your client feels safe, respected, and knows what to expect. For example, I start by saying, "Everything we talk about here is confidential, unless there's a risk of harm." This helps clients trust that what they share stays private. Next, I outline how sessions work. I might say, "Our sessions last about 50 minutes. We'll check in at the start, talk about what's important to you, and wrap up with next steps." Finally, I set boundaries and invite questions. I might add, "If you ever feel uncomfortable, let me know. This is your space." Taking these steps helps clients relax, knowing they're in good hands. Now, let's talk about establishing rapport with your client. This is the foundation of a strong therapeutic relationship. Start with a genuine smile and make comfortable eye contact. You might say, "Hi, I'm glad you're here today." Use open body language, relaxed posture, uncrossed arms, and a welcoming tone. This helps your client feel at ease. Ask a simple, caring question like, "How has your day been so far?" and listen attentively to their response. Show empathy in your responses. For example, you might say, "That sounds like it was tough," or simply nod to show you're listening. Sometimes I'll briefly explain how I work, just to make things less intimidating. For example, "I'm here to support you, and we'll go at your pace." Remember, the goal isn't to rush into deep topics. Focus on building trust, one small moment at a time. Now, before you dive in, take a moment. Assessing where your client is emotionally and contextually really matters. I like to begin with gentle, open-ended questions. For example, "What would you like to talk about today?" Or "How have things been for you lately?" You might also ask, "Is there anything on your mind you'd like to share?" These questions invite your client to open up at their own pace. As they respond, really listen. Notice their words, but also their tone, facial expressions, and body language. Are they making eye contact? Do they seem tense, or are their shoulders relaxed? Sometimes what's unspoken tells you just as much as their words. This part isn't about rushing or diagnosing. It's about meeting your client exactly where they are and letting them know you're right there with them every step of the way. As you wrap up your first session, remember these steps. Start by greeting your client warmly and set a welcoming tone. Next, explain how the session will go and reassure them about confidentiality. This helps your client feel safe and understood. Then, focus on genuine connection. Ask how their day has been and really listen to their response. Finally, as the session ends, offer encouragement. A simple "I'm glad you came in today" can make a big difference. And here's a tip. After each session, jot down one thing you did well. Celebrate your progress. You're learning every time.